Good evening, everyone. Just want to invite you on into this room right now and welcome you to Real Talk with yours truly, Pastor K. Real Talk, which we'll be launching on Thursday nights. It's a place where we can have some very candid conversations and dealing with issues that are impacting us individually as well as our community. And so tonight we're kicking off on the topic of cutting through the COVID clutter. Cutting through the COVID clutter. Now, if I can be honest with you, if you're like me, I'm really tired of COVID. I'm tired of talking about COVID. I'm tired of hearing about COVID. I'm tired of the arguments for and against the vaccine. And I'm tired of people talking at each other and not with each other. And if you are also like me, we're tired of how this COVID has turned into a political thing as opposed to being a public health issue. But here we are. And so there's still some things that we need to talk about. And that is the reason why we are here tonight. I just want to share with you how tonight's subject came to be. It was really right when in September, just when it was time for kids to go back to school. I was having a conversation with one of our concerned parents, and she was really, really troubled about her children returning to school, especially having one child who had some medical issues. She wanted her child to be safe, her children to be safe, but at the same time, she feared the vaccine just as much as she feared the virus. And so, it's regardless of where you stand with the vaccine, for or against, every parent and every guardian wants what's best for their child, and they want their child to be protected from the virus. No parent wants their child to contract the virus. But this lady, this mom, had heard so much rhetoric, if you will, and was hit with spot with so many people sharing about what they heard and what they believed until she really didn't know what to do or what to think. So she was literally standing there and she was like, I just need some help. Help me to get the right information so I can make a decision. In essence, she was saying, as the title of this session is, she needed help to cut through all of the clutter. And this mom, like so many people in our community, and including ourselves, is that we've been bombarded with both misinformation and disinformation. Now, let me share what the difference between the two, between misinformation and disinformation. Both are very deceptive. The difference is that disinformation is intended to deceive. And unfortunately, social media is the biggest culprit for both sides. It is the biggest culprit because it's putting out a lot of false information that has gone viral. And to be honest, any one of us could fall prey to it. We see an article and we think it looks legit, it sounds legit, and we share it out only to find out later on that it contained false information or outdated information or even misconstrued information, if we find it at all. So, according to the NPR, that's the National Public Radio, researchers have found that there's really only about 12 people who they label the disinformation dozen. 12 people who have been labeled the disinformation dozen, and they are responsible. Now, get this, they are responsible for at least 65% of the misleading claims and information about COVID vaccine that we find on Facebook, Instagram, and Twitter. I'm going to ask that in our comments section that we will list the names of those persons so that when you see information or anything coming from them, you would know they are part of the disinformation dozen, and you can just eliminate from your space and from in your mind so you won't be playing into that. All right, so it's coming up on your chat and you can see it over there in the comment section. So tonight we want to kind of get into some of the falsehoods and some of the myths, if you will, that we have been bombarded with. And we want to bring some clarity to information concerning that's been coming out of the CDC and the FDA. So let us also say that this conversation is really for persons who are really confused about the vaccine, for people who are still trying to make up their minds, especially parents now that the vaccine will soon be available for children 5 to 11. And so this whole session is really to help bring clarity or bring as much information as we can to dispel any false information so that parents and guardians can make a good decision, not only about them for their children, but for themselves. And so we can clear up some of that false information. So tonight, it's about folks who are really trying to decide. Also, I just want to add that if you would just hang on after we have this our conversation here tonight, that at the end of this session, we do have two awesome testimonies who are coming from two of our partners at First Christian who survived COVID, who came out of COVID, who they contracted the virus, had a really, really rough time with it, but God allowed them to come out of COVID to be healed, whole, and healthy. And that would be coming from Ms. Crystal Powell and also from our own Mr. Brody Flood Jr. They will be coming on at the end. So right now, I would like to welcome to our platform four awesome health professionals who are well equipped to bring some clarity to our subject on tonight. If we can bring them to the platform now. Good evening, ladies.
Good evening.
Thank you again for joining us. And let me introduce each one of you. And if you could just wave your hand when I call out your name, even though we do see your name showing up on the screen, I just want to make sure that everyone have an opportunity to see who you are. And so we can get into this conversation. I would like to welcome to our platform tonight, Dr. Maislyn Christie. She specializes in pediatric medicine, and she is
Hello.
a senior medical director at the Maryland Care Management Incorporation. Thank you very much, Dr. Christie, for taking time
Sure.
to join us
Thanks
today.
for having me.
Thank you. We also have Dr. Nina Everett. And Dr. Nina Everett is a partner at First Christian Community Church. Hi, Dr. Everett.
Hey, hello.
Thank you for coming. Dr. Everett is Chief Medical Officer at Aetna Better Health of Maryland. Thank you again for being here tonight. We really appreciate it. And we also have not only our own Fikirta Forrester. Fikirta has been with us a couple of times on these platforms. She is a family nurse practitioner. Again, for Fikirta, always thank you for coming in and helping us out. Really appreciate you taking the time.
Thank you for having me.
Thank you. And last but not least, we have none other than Irma Holland, who's also part of our health ministry at First Christian. And she's the Director of Clinical Education and Professional Development at Luminous, also formerly known as the Anne Arundel Medical Center. Again, welcome, ladies, and thank you again for joining us for this conversation. We really appreciate you being here. I would like to kick off, if you will, tonight. If we can just for the beginning, just to lay us out, if you could give us, to help us to understand the relationship between the FDA and the CDC. If you could help us with that. And Sister Irma, would you mind
Sure.
taking care of that for us, please?
Absolutely. Thank you. Thanks for having me also. So the CDC and the FDA have to work hand in hand. The CDC is our organization that takes care of health policy for the nation. When there's some diseases or what have you that are in the country or in the world, they work with the World Health Organization to identify these conditions and do statistics and data and make recommendations on treatment. Now, the FDA is the Food and Drug Administration, so their job is to investigate and approve drugs and other devices used in healthcare. So, where the CDC identifies there's an infectious issue, like they investigated and raised the flag on COVID. So they now we need a treatment for COVID. So that's where the FDA comes in when the drug companies develop a drug, any kind of drug from aspirin to this vaccine. They have to be the approving body to say what the drug can be used for and what it can't and how it should be used. They look at the research and the data that the companies supply and make determinations on whether it's safe for distribution to the nation. So that's how they work. And there is some question this week, if you're watching the news, or last week, about Dr. Walensky, the head of the CDC, who kind of went against, some people thought, the FDA's recommendation for who should get booster shots. But actually, the FDA had a very lengthy, very complicated, very close decision on whether or not to recommend vaccination boosters to adults, and they chose at the end to recommend that. To not to recommend booster shots widely, but to limit it to very narrowly. And what Dr. Walensky did was step in and say that she felt like, and the CDC still wanted to go a little further and recommend it for those who were more vulnerable, like healthcare workers. So it was a very close decision with the FDA. But erring on the side of caution, it was Dr. Walensky's call in the CDC as to make the recommendations for how we would go forward with boosters. And as a healthcare worker, I was watching it pretty closely, and I'm very happy that that just made that decision. The CDC made that decision for healthcare workers.
All right. Thank you. Thank you. Also wanted just to share, put out with our listeners, if you should have any questions, please feel free to just put it in the chat, and we will make sure that we will get to your question and hopefully answer it to your to help to give you more information, if you will. So since tonight's talk was inspired by a concerned parent, Dr. Christie, I would like to begin with you, please. It is anticipated that the FDA will approve and give a green light for children between the ages of 5 and 11 to receive the Pfizer vaccine. And there are some parents, like my daughter-in-law, can't wait for that vaccine to become available so get our grandson vaccinated. But at the same time, you have parents who are hesitant. They're reluctant about doing so. So what advice do you give, or would you give to a parent that, they're in that uncertain category? They're not too sure. What kind of assurance would you be able to give them?
Well, first of all, I would, it's very good when patients have a medical home, because hopefully before your child gets sick, you have an established relationship with a provider that you can trust. Because I think at the heart of what's happening is that a lot of parents, because of what's happening in the news, because COVID got a little bit politicized, we're polarized. And so the trust factor is really, for some people in particular, is very low. And if you as a parent have other anxieties, then COVID is just one more thing that just adds to your anxiety. So if I got a chance to talk to a parent that's very uncertain, I would try to explore with them, what are they particularly fearful of? What particular myth have they heard or have been exposed to? And it could be a myth from either social media, or it could be a news item, for example, hearing about children getting the vaccine and getting inflammation of their heart muscle afterwards. So I think getting an opportunity to share with your provider. So that's what I would do. I would explore particular fears, particular myths, and I would also so for each child, look at their individual past medical history, because that really helps for parents to make a decision as to, do I want to give my child the best chance there is to, one, not get COVID, and if you do get COVID, to survive. And so another thing I tell parents honestly is that no, this vaccine is not 100% foolproof, but the studies do show that people who do get the vaccine have a better chance of surviving, or pretty much a less, severe course of illness. So those are some of the things, and that's how I would particularly approach it.
You made a good point when you said if a parent has a good relationship with their healthcare provider, that will help to alleviate some hesitancy. So, which prompted me to start thinking about um, how comfortable are people with their healthcare provider with so much hesitancy being in our community? If you trust your doctor, then it would seem that if you go to your physician and your physician and he or she is saying, yes, I do recommend this, it just makes me wonder, are people really asking that question of their physician, or they're talking to the physician, but they're still coming out on the other side? Do you have any, or any of you have any take toward that?
So at least pediatricians kind of enjoy probably a little bit more trust than adult providers, because pediatricians usually get a chance to talk a little bit more
Okay.
to their patients, talk to parents. And so sometimes in adult medicine, just because a practice might be particularly busy, you might, particular person might have a lot of health issues. So you really don't get to do that talk with your doctor. And so that's, I think, is a big part that's missing, is that sometimes the providers, it's a time issue. So
Okay.
just having a good conversation for them to be able to just explore with you your fears, its time is unfortunately limited in some of these visits. And I think pediatricians have a little bit better rapport with parents and even, their teenagers. So I think that in particular is a plus for my specialty.
Okay.
Right. Oh,
I'm
is
sorry,
it-
Fikirta.
and I was just speaking on behalf of working in an adult clinic. I just started with a Luminous this week, and I'm noticing a lot of patients are coming in and they're very apprehensive about getting the vaccine. And I'm noticing the doctors are talking to the patients, encouraging them to get it. But if they decide that they don't want to get it, I don't notice any arguments or anything. I just see they just stand off and say okay, basically, because they're finding that they're arguing back and forth with the patients is becoming very difficult, and patients are saying they're biased and they're losing patients behind it if they keep going with you should get the vaccine instead of allowing patients to make their own decisions.
And if they're coming into they're coming into the emergency room?
No, they're actually coming into the doctor's office. So one of the questions we ask is are your vaccines up to date? And
Okay.
COVID, now that it's in effect, we ask about COVID, and they
Yeah.
don't want to hear that.
I don't want to hear. Yeah, that's
Yeah.
where we are right now. I want to come back to you again, Dr. Christie, and I think you kind of mentioned it when you were speaking about what to share with the parents, and that is regarding the inflammation that has come up with some teens and young adults who were experiencing some inflammation on the heart muscle,
Mhm.
and also on in that area. And then we do understand that out of the millions of COVID vaccines that have been administered, these are very rare incidents. However, it has and it does happen. How concerned should parents be? And is it caused by some pre-existing condition? And if so, what? Or do we even know what causes this inflammation in
Well,
certain
so I
states?
think parents should be concerned, and so they should be informed. And it's as you mentioned, it's pretty rare. And so normally, if you're going to vaccinate a teenager, you pretty much tell them some of the signs of you getting this pericarditis or myocarditis, which is inflammation around the heart
Mhm.
or inflammation of the heart muscle. So what we have noticed is that in older teens, usually males, a greater proportion of the ones of teenagers who have gotten myocarditis or pericarditis have been males, and it usually occurs after the second dose, and it takes up to about 4 days after you've received the vaccine. So teens are and parents are apprised of this information. the studies have not shown anything. We don't know yet whether it's a particular predisposition that makes this particular teen more susceptible. So we don't know, we don't have enough data yet, and we don't know. But what we pretty much do is warn the parents of what to look for. So if your kid has chest pains, complaining of their heart beating really fast, or shortness of breath, then definitely you need to alert your primary care provider. You go to the emergency room. In the emergency room, they're very well equipped. So most of the kids who have gotten this condition have been successfully treated and go on to be well afterward. So that's the good news.
Okay, so there haven't been any losses due to having this issue?
I did not see any. I cannot say for certainty that nobody has died. But I didn't see that in my data. I've just seen that most kids have recovered.
Okay. All right. Thank you. Fikirta, I want to come back to you again because we want to talk a little bit more about the side effects. And so if a person receives the vaccine and notices some changes in his or her health that's not listed as a common side effect, what should they do?
Yes, they want to hold off on definitely hold off on the second vaccination, and they want to make VAERS, which stands for Vaccine Adverse Event Reporting System, which is known as which was established in 1990. It's a national early warning system to detect possible safety problems in the U.S. for licensed vaccines. And they're co-managed by the CDC and FDA. So VAERS accepts and analyzes reports of adverse events. So if a patient have some kind of symptom that's not a common symptom from getting the COVID vaccine, they need to report to VAERS.
Okay. Right. And that's anyone can report to VAERS.
Yes,
anyone can report. And that does not mean that because it's reported, it doesn't mean that it's really an issue. They just collect the information, correct?
Correct.
Okay. All right. So we just want to make sure we did understand that. So, of course, we hear a lot, and we do understand that sometimes when research is being done for different medications, that there's usually a question as regarding the representation or adequate representation of people of color. So, Dr. Everett, could you speak to that for us, please, as to how was the vaccine tested? And were people of color well represented in the trials? And that's for both the adult and for children.
Okay, so let's start with facts. Black and brown people are underrepresented in clinical trial. Like, there's no doubt. And it's not really just COVID, it's many. Yeah. And we know that ensuring racial and ethnic diversity is really critical when you're developing the COVID vaccine or really anything. So there are a lot of reasons why people of color don't enroll in clinical trials. I mean, it may be that, clinical trials are expensive to run. So maybe your hospital in your community may not be offering it. Maybe you can't get back and forth. You can't take off of work. So there are a lot of barriers in place. There's mistrust of the medical profession. Certainly people talk about the Tuskegee experience and it makes people hesitant. That said, recognizing that our community has been disproportionately impacted by COVID. NIH and their research, they're doing a lot of work to really encourage people of color to enroll. And I found data for both Pfizer and Moderna, and it shows that Black people represent about 12% of the population, and they're a little bit less than 10% of the clinical trials. Latinos represent about 25%, and they're actually doing much better. They have much higher rates. So I encourage people that they should enroll in clinical trials, not only for this, but for other things. And I can say, when I looked at the rates of participation in COVID trials, this is actually a lot more than other medications. So when people, say, well, you haven't really done the work in Black and brown people, Black and brown people were not represented in clinical trials for things like aspirin and Tylenol. So that should not be the reason that people are hesitant to go ahead and get the vaccine.
Gotcha. So how does a person go about finding out about these clinical trials? If they want to volunteer and say, look, I want to be a part. What is the process? What do you do? How do you get there?
Yeah, I mean, at any given time, one can go online to NIH to see what clinical trials are in play. Certainly, again, you can look at any area hospital. You can call to find out what is out there, because I think it's important. Certainly, no one wants to be experimented on. And because of the Tuskegee experience, a lot of things were put in place to prevent that. So one should have a higher level of comfort by joining a clinical trial. And then really circling back to what we said before, people are so focused on their children, but oftentimes as adults, we don't take care of ourselves. We find reason we're busy, we're working, we have to pay the bills. And so our health is not always our priority. So that whole notion of establishing a primary care provider who you trust so that you're getting accurate information and you have someone to ask questions about. If you look on, that list of the people who are spreading this information, I mean, if you get your information from the internet, you don't know the quality of what's out there. You really want to go to people that you trust, and having a relationship with your primary care provider is really critical to that, I think.
So is there any type of promotion or program, I'm looking for the right word, that is directed to the community, people of color? Because if we're already hesitant and have distrust, how do we begin to convince people to trust being part of a medical trial? Is there anything in place where we're going out into the community, trying to have conversation, talking about the importance of it, that it is safe? Is there anything like that now? Because I just wonder how many of us would really do that.
No, that's a good question, but I can tell you that the NIH has specifically written into their grant funding that they want hospitals to reach out to people of color. Again, we share a disproportionate burden of the COVID cases. So it would behoove them to do the work in people of color so we could understand if there are any nuances. Thus far, they haven't seen any major nuances based on race and ethnicity, but doing the clinical trials will help us understand that, and really for anything. I mean, so this is really bigger than COVID. This is an opportunity for us to have this conversation.
Right.
But really, there are many things that come up day to day. Lots of new treatments that we need to make sure that we're at the game. We're in the playing field. That they're looking at us when they're trying to develop new technologies and drugs.
Okay, great, thank you. So again, you see a whole lot of stuff floating around on social media. And one of the things floating around is that people are asking, does the vaccine affect fertility, and can it change a person's DNA and cause cancer?
No and no.
And no.
I know.
I had to ask the question.
It's actually highly recommended that you get the vaccine if you're in the child bearing age, because it's basically saying that it's going to protect you and your if you get pregnant as well. So they're highly recommending that you get the vaccination.
Yeah. Okay. All righty.
And far as the DNA, I'm sorry, it doesn't enter the nucleus, so it's definitely not going to change your DNA.
Yeah. Okay.
And part of the cell.
So this other question I have coming up, it was I overheard someone talking, and they were talking about some saline was intentionally injected. And what they were saying was intentionally injected into some prisoners here in the U.S. So of course, I'm going to Google and see if I see anything about saline being injected instead of the vaccine. And The only thing I came up with was an incident that happened in Germany and one that happened in Canada. And the incident that happened in Germany, where there was a nurse that injected saline instead of vaccine into the arms of over 8,500 people. And then there was a nurse in Canada where 6 people, one was intentionally done, the other two, according to the article, and one was, pardon me, excuse me, so that you know where I'm getting it from, was off the cbsnews.com. So I'm going to some reliable sources to see where they were getting it from. And the other lady, to my understanding, she dropped the vaccine and didn't say anything to anyone, and she just went on and started plugging in saline into people's arms instead of making the correction. So that was in Germany, and the other one again was in Canada. Have you heard of any cases here in the U.S. and also what protocol is in place when the vaccine is being administered to prevent any kind of mishap of this nature from occurring?
I can plunge in the case in Germany. I read about that, and it was someone who did not believe in the vaccine. So she wanted to inject people with saline so that they would get infected, and then she could say, "Oh, look, it doesn't work." And I'm not sure about the case in Canada, but really, I don't know that there's anything that's in place, but that would really take place for any medication given anywhere for anything. So I wouldn't use that as an example of, oh, I'm not going to get my vaccine, because when you go, I mean, when you get your flu shot, when you go to your doctor, if you get any treatment or injection, I mean, one relies on the integrity of the health professionals, which is always coming back to going somewhere that's trusted. And again, like Luminous, big health system, and they have an excellent reputation. So, I want to get my care there. So again, you want to go somewhere where the hospital has things, and perhaps you could speak to that to make sure that those kinds of things don't happen.
Right. Okay.
Right.
Yeah. Were you adding something, Irma?
No, it's just we give all the time. A nurse, if you're in the hospital, if you're in the physician's office, they step out of the room, they come back in, they have the medication, they have a vial, and they didn't come to work that day. Most of them. There's some exception in every profession, but nobody shows up. Gets dressed, come to work to cause people harm. So we have a lot of safeguards in place. We have people, pharmacies who count the drugs and deliver the drugs, and then there are supervisors on all the time. So there's a lot of safeguards in place to make sure that medications in general are given the way they're supposed to be given.
Okay. Here's the other question. When the vaccine rolled out, and of course, healthcare professionals were the first in line to get it, which they should have been. I was really taken back by healthcare workers who wouldn't take the vaccine, and actually would say, I would just walk off the job. And after they have actually been through the storm of this thing, I mean, just from what the horror that we just witnessed on TV of, these critically ill people and the bodies being taken out and putting in cold storage. What is that? I mean, if
that's a fear factor. That's a fear factor at work. I mean, in anything, when there's a change, you're going to have early adopters and late adopters and no adopters. So I think fear is probably the overriding issue with people who, even after they've seen a lot of the carnage that has occurred in the hospital, that they would still refuse. And I mean, just being short-sighted in terms of leaving your job when, this is a time of economic crisis and there's some issues looming, for the future, that if you're walking off of a job, then, they kind of questions kind of like your thought process. So.
Right. I have to say also, just like you said at first, Pastor K, you're tired. Just to the doctors, the nurses, the administrators, everybody in healthcare is tired. We are all exhausted at different levels of exhaustion. That said, it really is taking me aback by how many, and it's not an overwhelming number. You know, you have to watch the news also and their exaggeration of some of the issues. But talking to some healthcare workers who are hesitant has taken me aback a little bit also, and trying to give them latitude to make up their mind. But we also have to look at the data on those who are refusing, kind of follows along the track of those in the nation who are hesitant or refusing the vaccine. So healthcare workers are the people next door too. So they have certain thoughts and ideas about why they shouldn't get it. Also, it follows the line of education level. Doctors, for instance, are taught a lot more about vaccinations and how they're developed and how they work than nurses, for instance. And then, nurses have to, that's one of my jobs, is to encourage people to look at research and to teach people how to look at research and understand it. So all of that is in play. Politics is in play. There are more Democrats who get vaccinated than Republicans, but it all follows along the pattern of the nation also.
And so you have the healthcare workers who don't want the vaccine for whatever their reason, and they're sharing it with their neighbor, and their neighbor saying so-and-so and so-and-so is a doctor or a nurse at such and such. And so they say they're not going to get it, so I'm not going to get it. So
yes, but you also, you should ask your neighbor who is the healthcare professional how many other vaccinations they have to have in order to work their job.
Right.
Because there's a lot of them. There's a page of vaccinations and things that we have to do to stay employed. And every year, if I don't get my flu shot, I am no longer employed.
Wow. I did not know that.
Absolutely.
Well, I couldn't wait for my vaccination. I'm just going to tell you right now. And I was like, you should have seen me trying to find the vaccine. And as soon as I get the green light because I got Moderna, as soon as I get that green light from Moderna for the booster, guess who's going to be in line?
And I've gotten my booster shot. So
I don't have time for Rona. I don't have time for her. I really don't. I need her to go. I just don't have time. But so that's where I am on that. So anyway, ladies, we're just coming down here to the end, but I wanted to hit back on a couple of more questions that came in. And one again was regarding COVID vaccine, regarding causing temporary lymph node enlargements that result in false positive mammogram. This again came off of John Hopkins when they were indicating this. And so the question is, should this impact when a woman schedules her mammogram? If they're saying this is a possibility that it can enlarge your lymph node and give you a false positive, should women now be looking at when they're scheduling their mammograms?
Most definitely. The COVID-19 vaccine can cause the temporary enlargement. So they recommend that you get it done. You're going to have your mammogram, get the vaccine 4 to 5 weeks before you get the mammogram, or 4 to 5 weeks after the mammogram.
All right. Can you repeat that again? Because I just ran across that, when we were preparing for this session. Can you repeat that again, please? So all ladies out there, please listen up.
Yeah. So if you're going to have your mammogram done, you want to get your COVID vaccine done 4 to 6 weeks before you get the mammogram, or 4 to 6 weeks after you get the mammogram.
All right. Thank you. Also, the other question that came in was, if I'm not at risk for severe COVID-19 complications, do I need the vaccine?
Yes.
How do you know that you're not at risk? So that would be the first question.
Right.
Everybody's at risk.
Everybody's at risk. Everybody's at risk for severe.
I think that we're all agreeing, but one thing I think it's important to think about, and this really goes with the health professionals too, but really everyone, it's really less about you than the other people in your travel path. So with health professionals, the concern is they're working so closely with people that they can make patients sick. But that really goes for all of us walking around living our lives who may not be vaccinated. You are at risk of impacting other people. So your decision is really bigger than you. And so I encourage people who may be on this phone, I mean, on call, who are not yet vaccinated, to also enlarge your thinking, enlarge your territory, so that you recognize that we as citizens of the world have some responsibility to other citizens. Um, and so that's another reason why to put on the plus side as you consider it.
Right, right. Um, Arlene Jones just put in the chat. She said, I had a mammogram the same week of my COVID-19 vaccine and had to go back to be sure the nodes were clear. She said, thank God all is okay. So
It's good.
that's great, Arlene. We're glad, happy for you.
Amen.
So, Pastor K, I just want to interrupt. There's a person that made a comment that a lot of low-income families don't have access to a pediatrician. And I just kind of wanted to bring that up because I don't want anybody, if you do have insurance, and particular if you're low income, it would be Medicaid, you do have access to a pediatrician, and that should not be an issue. And so if somebody doesn't know how to get access, then I'm sure Dr. Everett would be able to help, your congregants to get access and to know what path they need to have, because it's available to everyone.
All right. Thank you.
Sure.
The other question, getting immunity naturally is safer than getting it from a vaccine.
That's not necessarily true, because there are wild types of viruses. The wild type is sometimes a little bit more virulent. So you're probably going to get a severe illness. It's not necessary that you're going to have a better immunity afterwards. So people cannot take that chance to get the wild type or get infected before versus getting a vaccine. So that would not be advisable, because nobody knows with any certainty if you get the wild type how you are going to respond to it. So,
All right, thank you. And coming to the last two questions, and it's the death toll from COVID-19. Well, this is a statement someone is making. The death toll from COVID-19 is exaggerated. It includes people who were already sick and with other conditions. This is a statement someone has made. True or false?
False. What we do know is 700,000 people have died from COVID. So again, if you also come back with how many people have died from the vaccine, but I will say, so again, there's just the number is real. There has been some tightening up of how deaths are reported, because early on this was new. So there was a lot of times when the information wasn't as complete at the beginning as it is now, but they're really doing everything to tease that out. So that we can be more sure that the final cause of death is COVID. But we also know that people who have other health conditions are at much higher risk of COVID. So again, those people, it doesn't make a difference if you had heart disease and then the COVID, did you die of the heart disease or because COVID made it worse? It doesn't make a difference to a certain extent, whether it was a heart attack, COVID, or COVID. But if they coexist together, then you're at high risk of death.
All righty.
And I think another thing that people should really be afraid of is the disability that you're going to suffer if you do get COVID and survive.
Yes.
And it's a big toll to your family if you are the breadwinner and now you're no longer the breadwinner and you have to go on disability. And it's all the physical therapy and all the occupational therapies that you're going to have, and just the mental fog and the emotional piece. So COVID takes it takes its toll. So death is the extreme, but we're going to have a large proportion of people who are going to get the illness and suffer, so the quality of their life is going to be affected. So people really need to be very mindful of the disability that comes with after you've been infected with COVID.
I had a conversation with a couple of people in particular who had COVID, and it was considered to be a mild case for them. And they were sharing how much of a mind thing it was. They were saying it was like something just got into your head, and that was such a struggle for them. And again, it wasn't severe enough to go to the hospital, but it was enough for them, um, that they just felt like, I think the word that she used is almost like she felt like she was attacked, as far as her mental capacity is concerned.
Mm.
So it is
That's
very
the same
challenging.
complaint my mom had. She said just being isolated
Yeah.
mentally drained her. Just couldn't come out, and it was just being tired, couldn't talk on the phone, only able to text. It was mentally draining.
That's a lot. That
Yeah.
is a lot. And of course, the last question, I think I can answer that one that popped up, and it was, is COVID-19 vaccine the mark of the beast? And my answer to that is no, it's not. It is not the mark of the beast. It's not the sign of the Antichrist. Okay. So, let's go over to Revelations and we can break that down. But rest assured, it is not the mark of the beast. And we can have a nice little study in reference to that later on. But I just want to give you that assurance. All right. Okay. As long as we're good. All right, ladies. I think that covered all of the questions that we have and those that kind of popped up. I'm just looking down. I don't think we have any more questions coming up in the comments section. I think we are good. All right. Someone said no. All right. Are there any closing remarks for each one of you? What is one closing remark that each one of you can give to us in reference to what we have discussed tonight, or anything in general that's on your heart that you really just need to get off your chest or just need the public to know? Irma, I'm going to start with you.
Oh, okay. My closing remark is, a lot of people have talked about the science and the data and all of that. So I think the biggest piece of data that we really need to do is to just look at the numbers. Those who are not vaccinated or have a much higher chance of dying than those who are vaccinated. They have a lot higher chance of ending up in the ICU, and also dealing with those post-COVID problems that the doctor was talking about. So if you don't understand how they did the vaccine, and how they made it, created it, how they give it, just really understand that you are more likely to get severely ill or to die if you do not have the vaccine.
Okay, thank you.
And my going away remark would be is that if you trust your doctor enough to go to him every day, I mean, not every day, I'm sorry, whenever you need to go in for any other illness, I recommend that you listen to him and ask him about the COVID vaccine and explain it to you in a layman's term that you can understand, and that if you have that relationship with him, y'all can make a decision to whether it is worth, if it works for you.
Okay.
But
Thank
definitely listen to your provider.
So my closing remark would be to just minimize the source of having several sources of information, and develop the trust that you need with your provider. It's not only going to be working, during this pandemic, but going forward, I think everybody really needs to have access to good medical information and somebody that can help you, understand it so that you could get your best fighting chance.
you. Dr. Everett?
And I'll add that this is really bigger than COVID. As a community, we have to do a better job of taking care of our health. This is an opportunity to make a difference. So find that doctor, establish that relationship, and not only get your COVID shot, get your flu shot, know your cholesterol, know your sugar, know your weight. There's so many ways that we can make our health better. And the person who asked the question about platelets, the vaccine should not impact your platelets.
Okay.
But
Thank
certainly you
you.
can see the doctor if you have a problem. Okay.
Thank you for answering that. Well, again, thank you, ladies, for joining us tonight. And we are now going to bring on two testimonies, and who just shared briefly about their experience and how they brought them through. I just want to say to those who are listening this evening, First Christian has been really, really blessed. Yes, we did have people who did contract the virus, but thanks be to God, we lost no one to the virus. And I'm just so thankful for God for that, that we were protected. And even those who contracted, the numbers were still minimal. So we thank God for that. And we're hoping and praying that this has helped some of you who may be still in that in-between stage, especially with the children being able to be vaccinated pretty soon, that you'll be able to get this information and make a good decision. But again, what these ladies have shared here tonight, strongly recommended. Talk to your healthcare provider. You trust your healthcare provider, then trust the decisions or trust the information that they're going to give to you in reference to your health. Again, thank you, ladies, for being here tonight. And now we will share the testimony coming from our own brother Brody Flood and from Crystal Powell.
COVID is really serious. It affects different people in different ways, and it affected me to the point where I almost died. Had not God would have brought me out of my situation, I would have definitely had perished. But thanks be to God, He delivered me from all my sicknesses. I've had both of my vaccinations, and I'm doing well. I would suggest that everyone get vaccinated because it can help with those who haven't been vaccinated yet and who still might catch COVID.
I got COVID 10 days before Christmas. 5 days before Christmas, I was admitted into the hospital because I had a low oxygen level. I was in the hospital for 5 days being monitored because I'm borderline diabetic, and I have asthma. So I was in the hospital for 5 days, was released, went home, was in quarantine for another 10 days and being monitored with the device that was monitoring my oxygen level, my heart rate, and my breathing. After that, I saw my primary care doctor, and she put me on quarantine for another 3 months. So it was not until actually March 8th that I was able to leave out of my house and go to other places. I've been vaccinated, and I became vaccinated because, one, I live in a house with an 83-year-old woman who does not have an immune system, and I can't see me not being vaccinated because not just because of her, but also because I had COVID and I know what it was like.
All right. We want to thank Brody and thank Crystal for sharing with us. And we just want to thank God that both of them are doing well. So again, thank you for joining us tonight. We hope that this information has helped you. And so be on the lookout. So we have more topics that will be coming up. And so just be on the lookout for those announcements. Okay. Good night, everyone. And we will see you the next time.
Good night.
All righty.